Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending February 11th, 2021. As I have been doing in the last couple of weeks, I have several questions I'm going to try to answer this week. As always, I'll update on the progress of the pandemic globally in the U.S. and in our region. I'll talk a little bit about whether we're getting closer to herd immunity. I'll briefly mention the report that came out from the CDC yesterday about masks. And then I'll talk very briefly about how you can get more information about COVID vaccines. In terms of the pandemic globally, it continues to grow. As you can see, almost 2.5 million deaths worldwide, placing it clearly in the top 20 of the worst pandemics in recorded human history. Over 100 million known cases and a 3.7% increase in the past week. That's actually a pretty good number. As you'll recall, in the early months, we were seeing very rapid week-to-week growth in the total number of deaths. And then it dropped down into the mid-threes in September, October. Then the last couple of months has been 4.5% to 5% a week. That is, each week we're having 5% more deaths than the week before. So to see a 3.7 is reassuring, but we want to see whether that's going to continue or not. At 3.7% week-to-week increase, we would expect to reach 3 million deaths in about 6 weeks. In terms of where the pandemic is, I've shown you this before. Overwhelmingly, the deaths are in Europe and the Americas, as it has been for most of the last couple of months. In the United States, we've had almost 500,000 deaths from COVID, placing it as the number 3 cause of death in the last 12 months. We had 21,000 deaths in the past week. That's 3,000 deaths a day, and a 4.4% week-to-week increase. Again, that number's down a little bit, but not down as low as the rest of the world. And again, early on, our numbers were going up very quickly week to week, and then it dropped down to a low of 2.5%, and now we're at 4.4% this week. So at this rate, we'll get to about 500,000 deaths totally by next week. If you look at this, this is all of the cases that we've had in the U.S. since the beginning, and you can see that you can see where it's located. There's no real pattern here other than a clustering here in the north, the central part of the north, here in the southeast, and then along the U.S.-Mexico border and related areas. If you look at the cases in the last 2 weeks, again, this looks so much better than what we've been seeing. If you'll recall, you go back to August, this is where the U.S. was in the beginning of August, September, October, November, December, January, and now down to where we are now. In terms of our region, again, if you've been following these maps, this looks very reassuring. We're now no worse than surrounding areas. In terms of the states in our region, the number of deaths is very different. But if you look at deaths per million, you really see something quite remarkable. Tennessee and South Carolina are a good 50% worse or more than the states around them. In terms of week-to-week change, every single week, because the numbers are relatively small, these numbers will go up and down a little bit, but everybody seems to be progressing at about the same rate, perhaps a little bit worse than the U.S. overall. In terms of our region, in the Ballad Health 21 county service area, there have been 1,721 COVID deaths, about a 5% increase in the past week. So about where Tennessee, about where the U.S. is. At this rate, we'll get to 2,000 deaths in about 3 weeks. So the pandemic is progressing globally. It does appear to be perhaps slowing down a little bit, at least for the moment. So one question that will come up is, are we getting closer to herd immunity? Now, I did a video on herd immunity back in October. I'm not going to repeat it, but the idea is there comes a point at which there are enough people that are immune in a society, in a community, that the virus no longer spreads. So if you think about it this way, in any society, there are people who've had COVID and have survived. We think that 95 to 98% of them are immune. There are people who've been vaccinated. We think 95% of them are immune. And then there are all the people who aren't immune. All right. So let's look at and by the way, what is it going to take to have herd immunity? Nobody's absolutely sure. You'll see estimates from 70% to about 90%. So for this purpose, we're going to talk about 80%, not knowing for sure that that's right, but it gives us a sense. So let's look at the real numbers in our region. Right now, if you do a weighted balance of the 8 counties of Northeast Tennessee, 8.7% have been diagnosed with COVID and survived. An additional 6.7% have been vaccinated. So about 15% have had the disease or been vaccinated. So we would assume they're immune. I say about because we know some people have been vaccinated who also had the disease. So these numbers are not entirely distinct, but you get a sense of where we are. If that's the entirety of it, we're still pretty far. We're maybe 1/7 of the way as far as we need to get to have herd immunity. But as we've talked about before, a number of people have had SARS-CoV-2 infection, but were never diagnosed. And the CDC estimates that we know about 1 out of every 4.6 infections. If that's true, then we might have had as many as 40% of our population have COVID and survived. And on top of that, you add the vaccinated group, and you see we're still a ways away, but we're not as far as it might be. There's one estimate that uses a calculation that's available, and that is the reference down there, and that puts us at about 35% or so. So again, we are on the way, and I suspect that we're going to start seeing some impact of this lower number of vulnerable people. Having said that, there are some caveats we have to pay attention to. Remember, not everyone who gets the disease or has been vaccinated is immune. It may be possible that people who have been sick, who got the infection but didn't get sick, may have different level of immunity. We simply don't know. And we don't know how many people who got whether that 6.7% who got their vaccine also had the disease or not. We know that immunity may lessen over time. We know that immunity may not be completely protective. And it's even possible that those who are immune may spread the virus. And perhaps most concerningly, we're not sure about what's going to happen with these mutated versions of the virus. And so we're following the slow progression, the slow introduction of these emerging variants in the US. But by and large, I would guess at this point we would be reasonably accurate to say somewhere between 1/3 and 1/5 of the people in our region are immune, and we're moving towards some level of herd immunity. If we can get there before these variants or other variants become too widespread, then we should be okay. But again, that really reinforces the importance of wearing masks, social distancing, people getting vaccinated, and so on. And speaking of masks, yesterday the CDC came out with a report. And basically what they did was they looked at double masking and tight versus loose masking. And without going into too much science, I'll tell you that what they found was that tight-fitting masks are better than loose-fitting ones. That's not a surprise. Double masks are better than single masks. But perhaps the message from this that isn't being picked up as much by the media is that it is important both for the source and the receiver to wear masks. And it's actually more important for the source, the person who's infected. Because sometimes people say, well, I'm not worried about getting COVID, so I'm not going to wear a mask. But what you have to understand is you could be exposing other people. So these are the data that came out. And basically they said, here's just if you have an unknotted medical procedure mask. And these were all done. This was experimental, not done in humans. But you see, no mask for the source or no mask for the receiver is the gray line. So you see that pretty much the same level. If you double not actually wear a mask, if the receiver wears a mask, but the source does not, you reduce your risk a little bit. If the source wears a mask, but the receiver does not, you reduce it by quite a bit. If both wear masks, you reduce it the most. And then from that, if you double your mask, or if you have a knotted and tucked mask. So the important thing is wear a double mask, wear a tight-fitting mask, but wear a mask. Right? Especially it's not just for folks who want to protect themselves. It's all of us who want to protect each other. And then finally, how can I get my questions answered about COVID-19 vaccine? I get a lot of questions about the vaccine, and I'm pleased to share with you that on the 23rd of February at 6 p.m., we'll be offering a free webinar with Dr. Fiskus, Dr. Mormon, and Dr. Kursky are real experts separating fact from fiction on COVID-19. So please, there's the link there. If you're on the mailing list for these weekly updates, you should be on the mailing list for this Leading Voices presentation. If you're not, please let me know. As always, there's a great deal more information on COVID-19 at the College of Public Health website. If you or anyone you know would like to be added to our mailing list, please let Jan Stork know. I'd like to thank Melissa White for collating data and Dara Young for editing, producing, and posting these videos. And as always, my goal in this is to answer as many of your questions as possible. If you have any questions, please let me know. Sometimes I can't answer them. Sometimes they're very specific to an individual. But if I can answer them, I'll try to, either as part of these videos or in a responding email. So thank you very much for your attention, and please be well.